Hello, everybody. And I'm Irina Bond, and I'm the founder of Medicine Center. It's a hormone balancing center, online hormone balancing center, which means that you can order any products from anywhere in the world and consultations too. And we offer our support and guidance for ladies during perimenopause, menopause, postmenopause, but also during reproductive stage as well. We also have men as our patients, but majority of the times we of course offer our services to ladies. So today we are meeting wonderful Elvira, who is the founder of PeLove course, and we will be talking about urinary tract system, different varieties of symptoms. So, Elvira, nice to see you and nice to talk to you. I am not an expert in the field of pelvic floor, so I will let you to take over. If you can introduce perhaps yourself, please.
Sure. Hi, everybody. My name is Elvira Pauschka, and I am a pelvic floor expert, and I'm also certified in sexology and psychological counseling and hormone yoga. And I'm the founder of, as you mentioned, of the project. I call it international project. It's not because it's not just like one course. It's well-rounded support for women, which is called PeLove. And the name basically consists of two words, pelvis and love, because in short, this is what I am teaching women to do, love their pelvis. So, I mean, I'm helping women of different ages at every stage of their life, basically. And today I'm happy to focus on talking about pelvic floor in midlife.
Yes, exactly, because we have a lot of various symptoms. As we see in our center, our ladies come to us with not one symptom, but the main symptom that they come to us a lot of the times is, of course, hot flashes, night sweats. But besides that, the main symptom is vaginal dryness and urinary incontinence. And so the reason being for that is, of course, estrogen decline during post 40. We experience all sorts of issues and all sorts of symptoms, menopausal symptoms, perimenopausal symptoms due to estrogen decline, as you all know, and you, Elvira, first and foremost. So, yes, and that's what we face. And of course, we offer bioidentical hormones to our ladies, but we also offer the whole body support and the whole body approach we value a lot. And that's what you, Elvira, come with this approach.
Definitely, I do support holistic whole body approach because when we talk about pelvic floor, all systems matter and also lifestyle matters a lot. So I hope we have time today to touch upon base. But I just wanted to introduce actually the pelvic floor itself because we talk, but you know, it's better to see. It's sometimes better
Yes.
to see once than to describe. So pelvic floor is basically a collection of muscles, ligaments, blood vessels, which is interwoven within your pelvis. And it has a shape of a hammock, which is attaching to the pubic bone, and the other part is to the coccyx, so to the tailbone. And I
Yes.
call pelvic floor actually a superhero because this is a real superhero. Unfortunately, we don't really pay attention to it throughout our life until we get issues. But I call it superhero because of this S roles that it has. It stabilizes, supports our spine and pelvis. It has sexual role, a very important one. It has sphincteric role, you know, not to let any pee, poop, or gas out without our approval. And definitely, you know, when we work with the pelvic floor, we should work with the whole body. In the midlife, we have additional, as you mentioned correctly, we have additional factor that causes pelvic floor dysfunctions, like, you know, lack of estrogen or decreasing estrogen. And actually, all the symptoms that you also mentioned, they fall under umbrella, which is a medical term. It says genitourinary
Dysfunction.
syndrome, right? And it's like it's an official term that basically says that yes, so with decrease of hormone, we get vaginal dryness, we get leakage. Estrogen is responsible, right, for the thickness, for the elasticity of the
Absolutely.
muscles, for the synthesis
Muscle,
of the
floor.
protein. And once we lose it, the tissue is getting thinner. So even if some women, they didn't even give birth, but they come to me and they say, well, I'm 40, I didn't give birth. Why do I get leakage? Well, because you didn't take care of your pelvic floor, because you didn't have symptoms, and because, you have now less estrogens that can support the proper lubrication and so on.
Yes, absolutely. I can very much support that because I am a lady who haven't had children. I am 52. I've never had children, so it happened not by choice, but by life choice, I suppose, And I have to say that when we're coming into menopause, full menopause, I started experiencing a lot of this type of symptoms. Waking up in the middle of the night, wanting to go to the loo very often, um, sometimes not able to really hold it there for a very long time. So all of this, and of course vaginal dryness as well, so all of this, it's very much part of the deal, as we say, as I can say, once you get to that stage. And it's not just estrogen decline, but it's overall kind of aging process as well that is not helping either, unless you've had a very good lifestyle, and which I've had all my life, a very good lifestyle. So I could not really blame my lifestyle for that, because it wasn't nothing to do with my lifestyle. It was a lot to do, everything to do with the lack of estrogen or decrease of estrogen. And of course, overall aging, I suppose, as well, a little bit, maybe.
Yeah, our muscles, they basically lose the tone everywhere, and pelvic floor is not an
Yeah.
exception. And what is
No.
really important in the pelvic floor, like it has like everywhere, fast twitch and slow twitch fibers. And fast twitch fibers, they are exactly responsible for closing the sphincters. It's like when you sneeze, when you cough, and the sphincter has to react, right? This is exactly the type of muscles we lose first after the age of, even after 35 it starts decreasing, but after 40 it starts being really, like, women start feeling urge incontinence,
Yes.
stress urinary incontinence. So urge urinary incontinence is basically when you can't hold it, so you have a sudden urge, or you hear a fountain, you hear like a source of water, and you just can't hold it, so you have some pee out, some drops out. Or stress urinary incontinence is when you jump, cough, laugh, so you're getting that sudden intra-abdominal pressure on your pelvic floor, and your pelvic floor is just not strong enough to hold it, and then you pee a little bit.
So what are these muscles? Because that was my question, which was coming. What are the pelvic muscles that exist? Because I am not even aware of them exactly. So if you can repeat.
So yes, there are three different layers actually. So as I said, it's a complex structure.
Mm-hmm.
What I would probably mention as would say the most significant ones is the bulbospongiosus muscle, which is around the urethra. And this
Mm-hmm.
is basically the muscle which is responsible for the arousal. It is responsible for orgasms as well, because it's proved already, the stronger the pelvic floor muscles are, the more intense orgasm is, and it's a piece of the sexual life, the sexual health. And it is responsible, so it has that sphincter control. It's stopping the sphincter when you don't want to pee, when you don't
Yes.
give your permission to pee. And there is also like a bigger group of muscles, which is called levator ani muscles. And these are the muscles which are basically lifting the organs up, all these precious organs that we have inside, the
Yes.
bladder,
Yes.
the uterus. Not everyone has the uterus by the age of 50, but you still have the vaginal walls that used to,
Yes.
be attached to it. You have the rectum. So all these muscles are basically lifted. So if the bulbous spongiosis is more like the squeezing, it has the more like a squeezing type of movement, and levator ani is responsible for lifting the organs when you cough and you jump. So it's like having that support. And also pelvic floor, when you speak about pelvic floor, it's also very important to speak about another muscle, which is not in your pelvic floor, but it is above your pelvic floor. It's the diaphragm, our respiratory muscle. So that's why whenever you see like a pelvic floor video, they talk a lot about breath, how breath
Yes.
is affecting the pelvic floor, right? So when
Yes.
diaphragm, our respiratory muscle goes down, pelvic floor is kind of catching that pressure, lengthens in response to it, and supports all the organs. And when the diaphragm goes up on exhale, then the pelvic floor is being lifted as well. So they work as a team, also with the abdominal muscles on the side. So
Yes.
it's a team actually, and that's why, as you mentioned, the only holistic approach would work. So it's not enough just contracting
Yes.
your pelvic floor like 500 times per day.
So this is one of the reasons why it's not enough only contracting this, right? Because it's holistic approach and a lot of different aspects involved into keeping your pelvic floor actually intact and keeping it healthy. So what are other aspects that involved to make sure that your pelvic floor is actually in good condition by the time you're 40 or even 50 or even 60?
So as I mentioned, lifestyle, I would always start with the lifestyle because I'm happy to share like, the exercises or like at least the most significant ones, the most important ones. But lifestyle, the way you go to the toilet. So if you're constantly having a constipation, so you're bloated, constipated, this is number one enemy of your pelvic floor health. It is really important to address your nutrition, chia seeds, flax seeds, drink
Fiber,
enough,
yes.
like sipping, not chugging water, sipping water throughout the day is essential. And when you defecating, make sure you use, the chair under your feet. So they call it like squatty potty,
Mhm.
which basically helps the second sphincter, which is internal sphincter, to open up, to blossom and to relax instead of straining. So straining when you poop, when you pee, is horrible for your pelvic floor, which we should all know. We never should rush in the toilet. We should never
Yes.
push in the toilet. The same with the pee, power peeing, how they call it. When you're in a rush, you just want like, okay, I have to pee quickly, and then you push it. So we don't do that. We don't go just in case to the toilet, just like squeeze out something, because I don't
Yeah.
know where's next occasion I get the toilet. So I will just go and squeeze out something for now. This is this is exactly the way of disrupting the brain and bladder connection, because the brain just doesn't know, like it's gonna signal you much more often. And some women with urinary incontinence, they also mentioned to me they stop drinking because they think if they drink less, they're gonna go less or they're gonna avoid incontinence. But this concentrated urine is actually very dangerous because it does exactly the opposite. You just go more frequently because it's getting irritated. Plus, in midlife, especially when the UTI, risk is higher because of the like tissues and all what we discussed, it can provoke more and more infections. So always stay hydrated. We relax on the toilet. It's a ritual. We don't push. We don't go just in case. So these are like very, simple lifestyle tricks, but the
Yes.
tips, but unfortunately not every woman, even after like giving birth, know about it. Like even, I mean, like
Yes.
mature women. So
Yes. Yeah.
definitely posture. And posture affects actually a lot in our body. And if we go specifically for pelvic floor, so when you're slouching, when your posture is bad, your pelvic floor, so your pelvis actually is shifting out of alignment. And we have,
Hmm.
the pubic bone here. And pubic bone helps the pelvic floor muscles to hold all the organs. But
Yes.
once you're losing your posture, your perfect posture, so the pelvic floor, the pelvis is shifting. The organs are losing that support from the pubic bone. So pubic bone is no longer functional, and then all the load goes where? It goes to your precious pelvic floor muscles who, they're superhero, but they need support. They need you to pay attention to them and to pay attention to the posture, pay attention to intra-abdominal pressure. The way we train in the gym also. You told me you did yoga for years, like you're a very healthy lady, and you know how to like engage it. But honestly, I haven't seen many fitness instructors who actually tell you what to do with your pelvic floor. They don't give you
Yes.
cues for the pelvic floor. And I'm always sad because like lifting so many weights without proper management of your pelvic floor,
Yes.
without
Yeah.
proper breathing, I see a lot of women holding their breath when they do even Pilates, reformer Pilates, which is very trendy now, can be very damaging for your pelvic floor if you don't know how to take care of it.
Yes, yes, absolutely. Well, the technicality of things should be there for sure, because you can do exercise in one way, but if you are technically savvy and you know how to do it properly, then it can be a completely different way and much easier way, actually, if you do it technically correctly, right?
Yes, yes. And of course, hormonal therapy, I would also advise it in case of
Yes.
vaginal dryness specifically. You can maybe tell me more, and I will be happy to refer my clients to your clinic because a lot of women, they do have. And yeah, you can address many things with exercise, but once the tissues are not the same as they used to be, you need to supplement with
Yes.
systemic estrogen, with topical estrogen. I'm not an expert, but I'm so happy I found you. So now I have an expert I
Yes.
can
Yes.
refer to. So
So,
what
well,
is your
also,
take on this? Yeah, what is your
yes. So as you
recommendation?
know, with the age and these days, it happens earlier than later, to be honest. We see ladies of 32, 33 coming to us already with some symptoms, believe it or not. So the estrogen decline causes all sorts of chaos in our body, including our urinary tract system, which means that it could be vaginal dryness, which means that it could be urine incontinence. And we can, by optimizing that estrogen or estradiol, really, the most potent version of estrogen. There are 4 estrogens, so we concentrate a lot on estradiol, which is the most potent, the most antiviral, anti-inflammatory hormone, and we try to bring it up so that our next time when you do results, blood test, and see the results, the level is much higher than before. And so we see the difference in our ladies' symptoms, vaginal dryness. We also use vaginal cream, topical cream, but majority of the times, estradiol in the transdermal one is enough actually to get that lubrication back, to remove that edginess of vaginal dryness or urine incontinence or constantly getting infection in that area due to lack of estrogen, estradiol especially. So bioidentical hormones, that's what we offer. Bioidentical hormones, we offer also peptide therapy, really do the job. And they do it super, super well. Lifestyle, of course, we are the first ones who tell also that lifestyle is the key to the whole holistic well-being and the whole body kind of health. But we believe that once you get to a certain age, and your estrogen or estradiol is very low, and the tissues, the walls of the urethra and everything else is already affected by lack of estrogen, then there is nothing much you can do at that point. You can preventative approach. It's very much what we also promote with exercise, with everything else. But then once you get to that point, unless you combine it with bioidentical hormone therapy, the effect might be on a slower side, right?
Yes, yes, absolutely. And I think you have to work from all directions.
Yeah.
And it's better, like in terms of, if I would talk about exercise, it's better to start earlier. So it's better actually to start in your 30s.
Absolutely.
it doesn't really matter if you are pregnant or not. So right now, actually, I see women coming. They do horse riding or tennis player. I had gymnastics woman who was professionally doing gymnastics who had this issue. So it's not just about midlife. So that's why knowing that in midlife you might be your health, your pelvic floor health might be compromised, it's better to start a little bit early. And then as you feel, you can have a consultation, I guess, with you, right, with the doctors of your
Yes.
clinic and get the right dosage of the estrogen. I'm also very much supporting some non-hormonal supplements like vitamin D, because
Yes, of course.
according to
Yeah.
research, it's also shown that women with a higher amount of vitamin D, they have less pelvic floor dysfunctions.
Yes.
Sea buckthorn oil orally can also help with, lubrication and so on. But yes, there is a point when, this is a way to go. And I really want women not to be afraid of the word hormone.
Yes, which is the case actually a lot of the time still, but there are different hormones of what we had 20, 30, 10, even 10 years ago. Nowadays, we have different hormones, hormones that are super powerful, yet they're not going to create any unwanted, and we know which ones, cancerous cells in your body, because they don't have enough power to get attached to your receptors, to your hormonal receptors, wherever they are. And therefore, they cannot physically, biochemically, they cannot create. It's a different matter altogether if a woman had already had any condition like that prior to having a hormone therapy. Then we will need to look much in more detail into her medical symptoms, into her medical history. But if you are a healthy woman, a woman of a 35, 40, 45, 50, 55, 60 even, with no condition, major condition, which we do have a lot of women like that still, or with some condition, let's say diabetes or cardiovascular maybe, or any other, actually hormone therapy can help you with all those conditions. And if you start early enough, can prevent those conditions from even appearing from your horizon. So that's how powerful hormone therapy, correctly done in a controlled fashion, with supervision, with post-treatment care. That's what we offer at Medigene time and time again. Our ladies are so happy because they can call us, they can contact us anytime, and we are happy to provide some support. So that type of hormone therapy is very much helpful. If you are taking your hormones right, left, and center, going into any pharmacy, buying some synthetic ones, just popping them into your body as if there is no tomorrow, then the question mark is, what is the long term of that therapy, and who have prescribed that therapy in the first place? Definitely not at Medigene. We don't do that this way. Definitely we need to have a blood tests, or more seriously done, the Dutch test, the Dutch Plus, the Dutch Complete, or GI map. We do very much so, or any other test that can help us to see where you are in your hormone levels, but also in your metabolites of your hormones. Because seeing hormones first, at the first glance, okay, maybe everything is fine, but how are they metabolizing in your body? Then it's a completely different story. If they are not being processed well by your liver, by any of your detoxification organs, then there may be an issue down the line with some of them organs in the first place. So we will need to look into it more precisely, more in detail, to address that point, because that could have been a condition that came even before your estradiol started decreasing.
Yeah, I really love your approach, and I respect how well educated your team is, and they look to the root cause as well. Because what I unfortunately hear, a lot of women feel often dismissed going to the doctor, or they just getting some prescription, but not much is explained to them, and that's exactly what you mentioned. So yeah, you're doing a great job. So
Yes. Thank you so much. Thank you. Well, a lot of the times I think um, doctors being in a hospital, they don't have enough time to spend. And being in a clinic, you allow that time a little bit more, for each and every patient. And you have a personalized approach, and it's a private clinic. So it's a very different one. Even if it's online, it works wonders, for a lot of people who are not really physically, they will never be able to access this service unless you have that type of clinics.
yeah, great, great. It's
So,
really
one of the questions that I wanted to ask also, how can we deal with any pelvic floor issues? Let's say if they're already advanced.
so it really depends what kind of pelvic floor dysfunction we're talking about. If it's let's talk about the one which is affecting like almost 50% of women after 50, which is pelvic organ prolapse. So pelvic organ prolapse is basically when the bladder, the uterus, or the rectum is like bulging into the vaginal canal, and women might feel this bulging feeling. They might even say, "I feel like there is a foreign object in my vagina, so something is just there, which is not supposed to be there." They have constipation, like
Mm-hmm.
chronic constipation. They can't even like fix it with nutrition, because what happens if it's rectum is the rectal cell. So if it's a rectum which is bulging into the vagina, there is a pocket where the stool is constantly being stored. So the woman is having difficulty of relieving it. The same with the bladder. So if the bladder is out of the optimal place, you might have difficulty of emptying it completely. You just went to pee and you feel it's still kind of full. So you just keep going and going, and you're not emptying it. So in this case, definitely there are different stages. Okay, let's start with that, because I always say that stage 1, 2 can be, at least like the symptoms can be relieved very well with the exercise. And in my program, which is 5 weeks long and has a full my supervision, it's online, we're addressing that. If it is already stage 3 and 4, on stage 3, it can become stage 2 if you're really like, religiously training, okay? So 15, 20 minutes a day you dedicate to your pelvic floor. And stage 4 usually already requires a surgical treatment.
Mm-hmm.
Um, there is also another solution, which is like medical solution, which is adjusting the pessary inside, which
Yes.
is like keeping
Mhm.
whole organs on their place. But I would always start with exercise.
Yes.
So I would always, and even if you had the surgery, there is a higher probability that you might need surgery years later, because you didn't really address the root cause. Like if you had a bad posture, you didn't address the posture, they just kind of, lifted the organs, they put it back to the place. But if you just chronically slouching, then you will get prolapse as again. So especially,
Yes.
during menopause. So it doesn't mean that, okay, I just like we'll do the surgery and it will all solve it. Even after surgery, like 6 weeks after surgery, doctors advise you will to exercise to maintain the results. So I think one way or another way, exercise is the answer for pelvic floor dysfunctions like pelvic organ prolapse. In terms of urinary leakage, that's sometimes connected, sometimes not to prolapse. So it can
Mm-hmm.
be, actually, you can leak even without prolapse. And that's again about exercising. We should work with the breath. We should work with the diaphragm. So there, for a lot of women, the diaphragm is kind of, in spasm. So it has adhesions, because we women, we tend to breathe with our chest a lot. We get anxiety, we get stress, we start breathing with the chest a lot, which basically means that our diaphragm is not functioning that well. So there is
Yes.
no this constant dance with the pelvic floor. And we need to work with the breath work. We need to work with the posture, definitely. Like that's really important. We need to even work with the jaw. Like, how surprising, right? Where's the jaw? Where's the
Yes.
pelvic
Yeah.
floor? But if you're clenching your jaw, then you might be probably clenching your pelvic floor as well. And I heard even some midwives, they during the delivery of the baby, they are telling to the woman, sing, like because when you sing, you're relaxing your jaw and
Yes, yes, yes,
you're
yes.
opening it. So it's like also, affecting your pelvic floor. We need to work even with the feet because the feet, and I'm showing you the ball that we use on the course as
Yes.
well. So we need to make sure we release the fascia all over the body because whenever there is a spasm, adhesions throughout the body, it might affect your pelvic floor.
Yep.
Yes, so basically I was talking about the holistic approach, exercising not only your pelvic floor, exercising your diaphragm, working on your posture, working on your jaw, working on your feet, working on your
Yes.
piriformis muscles. So it's a whole body approach.
Interesting you mentioned about the feed because I very much love the approach of energetic healing, and I'm very happy that these days this approach is kind of more and more visible, in the daily life. And so many, many years ago when I was a little bit down in my personal life, like 10 years ago, 12 years ago, I was still living in London. I started going to one of the energy healers in London, quite a famous one. She's been in LA, she's been in London. And recently, when I visited her, every time I go back to London, I visit her for MOT of the whole body. So I
Mm-hmm.
don't quite go to doctors, but I go to energy healer for my MOT. And so she did tell me that at the time my root chakra was actually affected. And if it wasn't for my really strong feet, as I used to dance ballet as a ballet dancer,
Mm-hmm.
she probably wouldn't be able to get that energy going. And she only was able to do it thanks to my feet.
Mm-hmm.
I
Yes.
was so surprised. Her herself, she was quite surprised that how it went really quickly because my feet were very kind of, strong, and I started pumping that energy immediately almost. So
Yes.
that just tells you that there is no only one pelvic and that is it, and that's how it functions. There is no only one heart and that is it, and that's how it functions. There is no only one, I don't know, liver, and that's how it functions. It functions, the whole body functions together. And unless we approach it from that perspective, then we
Absolutely.
are nowhere. There is no way we can really live a fully healthy and happy life, I think.
And just you reminded me, I wanted to give an advice actually, like because you're talking about feet. Since we're talking about feet, I will give this
Yes.
really useful tip that helps to a lot of my clients because what happens as we age, we start going to the bathroom even during the night, even if you let before you slept through. Now
Yeah.
you might notice that you wake up to go to pee.
Yes.
And
Yeah.
for some women, it's a problem. And what I advise them to do, which I really like this advice, it was given by one pelvic floor physiotherapist, actually. So 30, 40 minutes before you go to bed, lay down, put your feet up, like legs up. So it's like L shape. Okay. So you're here,
Yes.
you put the legs up, and you start pumping your feet up and down, like that for 10,
Yes.
15 minutes. And what it does, it basically helps to lymphatic drainage. So it helps the lymphatic
Yes.
drainage. It helps to shift all the liquid from the body to your kidneys, that your kidneys will have enough time to process it into urine. And hopefully your last bathroom trip before going to the bed will be like a full relief. So it's going to be, you
Yes.
know, it's going to be really good for your kidneys as well, that they can rest. And it sounds like very simple, but it helped to a lot of my clients. And it also helps with this when your legs are tired, you're walking all day or even sitting all day, it's always good to put them up. But it can
Yes.
also help with these bathroom trips that you just stop
Yes.
going
Yes.
during the night.
Well, very useful, and it's not difficult to do actually. I've seen it on your main feed this video. Very interesting. How many hours before going to bed you do that?
I think now I said like 30, 40 minutes. It's better to give it an hour.
An hour, yes.
Just that, it has the time, but
Yes.
you do it for 10, 15 minutes. I mean, it's quite hard, actually. It's getting harder to do, but you can do as much as you can.
Yes, yes,
You can
exactly.
start with it, but it's a really good practice.
Yes, exercise.
Yeah.
Yeah, that's very helpful, and it makes sense. It does make sense, actually. What tools or devices, that's another question that I've had, would you recommend to use?
Yes, so I am very careful when I'm selecting a device when I talk about devices, because you've probably also seen the devices which, you insert into the vagina, and then there is an application that you basically contract the muscle, and then a bird or something is like flying or jumping. So you're playing the game, and then at the same time, you're training the pelvic floor muscles. The idea is brilliant, but we have to be careful with this kind of devices, because what they can do is actually get the pelvic floor too tense. So it can become hypertonic, because sometimes I tried it myself. I have a device like this. Sometimes this game is so fast, so you need to contract it so fast and for so long that it can happen that the pelvic floor will just go in tension. And tense muscle is not strong muscle. It's a weak muscle in tension.
Yes.
And that's why I'm always talking about it, that even like before we strengthen, we need to relax. A lot of women, they have like very strong tension in their body.
Yeah.
And this is, I always show this. I will show it now as well on biceps. So if you imagine if my biceps is very tight, I can't flex my arm at all.
Yes.
And if I need to lift something, it's going to be very heavy for me, because the range of motion is very small. But
yes,
if I can, my muscle is strong and it's also flexible, it's elastic, then I can flex it, and then it's going to be very easy for me to lift things. The same for the pelvic floor. So we need to make sure pelvic floor is able to be flexible as well. And with this kind of tools, it's a bit difficult. If you will properly do your stretching afterwards, and you are aware how to do the stretching afterwards, then maybe it's okay to do it 10 minutes a day. That's fine. But it needs to be supervised, to be honest, because you can really make it worse. And the device that I use, what I love, which is, I think it's really helping with understanding if you're doing it, first of all, correctly, and if you are doing it and how you're progressing. So it's also showing you how you're progressing. It's a vaginal ball. It doesn't have big weight in it, because the weight is also not always good. The weight is for already advanced pelvic floor strengths, which most of women don't have. So we have to be careful, because it can get the symptoms worse. So basically how this works, you put this part goes into the vagina, and we have a small laser at the bottom. This part is totally out. And you have this kind of, a ruler that you attach on the wall, and you go like 2 meters away from the wall. And once you contract your pelvic floor muscles, the laser will go down, and it will show you what is the amplitude, what is your range of motion. Is it 20 centimeters, 30 centimeters? So it's kind of motivating, because you might start with 10, and by the end of my program, you can already do 80, which means that your range of motion improved so much. So your pelvic floor muscle strength. But the other function, and actually the first function, which I like the most about this, that it will also show you if you do Kegels or contractions incorrectly. Because if you do them incorrectly, you are pushing instead of contracting, the laser point will go up and you will see it. So you are basically able to have this feedback right away from the wall, and it will show you exactly if you're doing it correctly. Plus, it will show you the progress that you make. And this is the device I use. Of course, there is
very interesting
device that physical therapy use, but again, if your pelvic floor muscles are functioning well, you can feel them I don't think you need actually a doctor. You don't need to go to physical therapy to do this TENS device. That when they, they can see the contractions on the monitor,
Yes.
and they like mechanically, but stimulating it. If you are able to do it yourself, you can perfectly do it at home. However, I would still recommend to do it under supervision, which I
Yes.
provide.
Yes, absolutely.
Yeah.
Well, very nice talking to you. I've learned a lot. I have to say, each time I'm talking to some area specialist, I'm expanding on my, knowledge of women's health. So very interesting. The course that you are providing, it's also could be very interesting and very helpful for our ladies, PeLove. So whoever is watching us, please do contact Elvira to perhaps jump on a course and do it and try all sorts of ways of improving your at the same time sexual health as well, because that
Exactly. We
leads
didn't
into
touch this
sexual.
big, part, but
Yeah,
it's in
we
there.
haven't,
Yeah,
but we should talk about sexual health as well. We will set up
absolutely.
another, hopefully, live when I am in France. Then we can do any lives possible, impossible. We will definitely set it up, and we will definitely do it live, because this is the area, as I mentioned to you, we don't talk a lot about, but we should. We should get
Exactly.
familiarized with this area a little bit more, all of
Yes.
us.
Yes, yes. Thank you so much. And I'm happy. Yes, you can. I am offering free consultation. My initial free consultation is free. And this Sunday, actually, I will have a free incontinence related and bladder control related webinar, which is for everybody. Again, you can register via the link in bio. And also in my bio, I have a free guide for pelvic floor where women can assess their own muscles.
Mhm.
So it's also very useful. So I have a lot of free resources, and women don't have excuse not to take care of their pelvic floor. So it's all free.
Absolutely.
The first steps, I mean, are free, and I will be, happy to talk to women from your audience. And I'm really happy to share your hormonal therapy clinic contacts with my audience as well, and with my clients.
Thank you so much. Thank you, Elvira. Very nice speaking to you, and speak soon.
Thank you.